Good morning, good afternoon, and good evening, alumni. Welcome to this live discussion on COVID-19 with the Vice-Chancellor of the University of Cape Town, Professor Mamokgethi Phakeng. This event is being put on by the Development and Alumni Department. We were told that close to 600 of our alumni around the world signed up to be part of this live discussion. It's a first for us. We want to thank our ICTS, our Information Communications and Technology Department, for providing the platform and making this possible for us, and our Communications and Marketing Department as well, to get the message out to you. Under these extraordinary circumstances, we thought it was important for us to try to find a way to reach out to our alumni so that we could update you on how COVID-19 was impacting on the university and how we were dealing with COVID, and what plans the university had during this very challenging time. So with those brief opening welcome remarks, we'll just ask you to bear with us because this is our first. So if we have any technology glitches, we'll try to sort them out, because we hope that this will be the first of many other engagements. So it's now my pleasure to invite our Vice-Chancellor, Professor Mamokgethi Phakeng, to start this live discussion. She will also tell you that she is joined by members of a senior executive team who would also be available if there are any questions that may come up. Just to let you know that we have received a number of questions beforehand, and the Vice-Chancellor is aware of these questions, and I'm sure that in her address she will try to respond to many of those questions. But if not, there will be an opportunity for you to post questions. There's a question and answer feature, and we will try our best to try and answer as many of your questions as possible. The Vice-Chancellor will speak for about half an hour, and then we will have another half an hour for questions and answers. So welcome again, and over to you, Vice-Chancellor.
Thank you very much, Russell, and good afternoon. Hello, everybody. I can see at least about 300 people joining us from all over the world, mainly in South Africa. Hello, Sanbonani, Dumelan, Molweni. It's really wonderful to connect with you at this trying time. But I want to begin with some good news. Of course, I'm joined online by the Deputy Vice-Chancellor for Transformation and Student Affairs, Professor Loretta Ferris. Professor Sue Harrison, the Deputy Vice-Chancellor for Research and Internationalization, also joins us. Associate Professor Liz Lange, the Deputy Vice-Chancellor for Teaching and Learning, is also on the line. We also have the COO, Dr. Reno Mora. The Registrar, Mr. Royston Pile, is with us, as well as Professor Valmis Rahi, who's an expert in infection.
Okay, we see you back now. There was just some technical glitch, but that's been sorted out. So maybe we could start over.
Yes, so I was still introducing colleagues from the executive management, and they are with us. Later on, we will go to them for answering some questions. I'm sure many of you would like to know about the academic program, how we plan to complete the academic year 2020, and what our plans roughly for 2021. But I wanted to begin with some good news. The first students to test positive for COVID-19 at UCT has now fully recovered, and this is good news. The student left self-isolation over a week ago, and so far we had 7 cases of COVID-19, 4 of them being staff members and 3 of them being students. So 1 of them is now fully recovered, so which means we only have 2. And as we get the news, we'll keep updating you. Of course, we are not complacent. We are seeing the rise of infections and deaths related to the pandemic across South Africa. And we know that students who have gone home for lockdown are located across the country and the continent. But we hope that the lockdown and practice of physical distancing will help to keep the number of infections down. Let me begin here. I mean, I recalled when I joined UCT in July 2016, and for the first 6 months when I joined UCT in 2016, I shadowed Professor Danny Fesser as DVC Research and Internationalization. Towards the end of 2016, I was asked to give a keynote address at the launch of UCT's annual research report, which I described as a celebration of success. Delighted as I was about the success that year of research at UCT, I cautioned colleagues in attendance that evening that I'm very aware that what had brought us to that success may not be sufficient to get us to our next success, because we live in a world of national and international uncertainty and unrest. And that's how I described our world back in 2016. Already in 2016, I emphasized that the world is wobbling on its axis, spinning with unfathomable challenges. The old certainties, good and bad, are unraveling. And what we thought we knew, we no longer know. And I said we can only be confident that in the coming decades, we will encounter a world of rapid and almost unimaginably profound change. And a question that I asked colleagues to consider on that occasion is how we as UCT could possibly be prepared for the multiple and unforeseeable challenges that await us. This question is still relevant today. On that day, I argued that to cope with this uncertain future that we face, we are going to need three things. I argued that we're going to need an unrelenting commitment to excellence. I argued that we're going to need an exceptional focus on transformation and the courage to do things differently. Fast forward to 2018, when I contested for the job of Vice-Chancellor, and I argued that we must forever bury the notion that the global is somehow not African, because the global is local. I argued that our local problems are also global, and the global problems are local. Problems of Africa are problems of the world. Gone are the days when people thought infectious diseases are problems of Africa. Here we are today. Higher education around the world is facing the same set of uncertainties that we as UCT face about when institutions can resume face-to-face learning. The truth is that we don't know. US universities are being advised to plan for the possibility of online teaching and learning until September 2021. And at UCT, we are aware that a return to normality could take a bit of time. Along with other South African institutions, we are thinking about many of the same things as universities in Western countries. Do our academics and students have the tools they need for online learning? Do they have laptops, data, Wi-Fi? But in the South African context, given our social consciousness, we have to consider the deeper issues of poverty and how that may affect studying at home. To complete the academic year at UCT, we are also thinking about solutions for all our students, including those whose environment is not suitable for learning, as well as students living with different kinds of disabilities. Online learning is just one of those solutions. It can work for students with the right environment and tools. So we have conducted a survey to get a sense of the needs of our students. As a result of that, we are providing laptops on loan to financially needy students. These are laptops that we do not necessarily have. We've had to buy them. We have negotiated with service providers for free online access to UCT websites. And so far, we have CellC and Telkom on board who have agreed to this request. And we have been working with academics to develop online teaching materials in a very short time. But we know that online learning is not an option for every student. And even those who do have tools, those who have the laptops and access to unlimited and capped Wi-Fi, online learning may be only a partial solution. Because if you can think about it, all of our students decided to come to UCT because they knew it's a face-to-face university. So we have developed a plan to assist vulnerable students with blended learning, combining online lectures and face-to-face tutorials once the campus can reopen. The COVID-19 pandemic has brought into sharp focus the inequalities that we already knew existed across the world. Those inequalities are not only in South Africa, but they are across the world. Many, even most of our South Africa's university students come from families and communities of deep poverty, including remote areas where they do not have access to electricity and running water, much less the internet. UCT has been surveying students about their conditions at home and how that may affect their potential to study remotely. Our questions have been targeted to identify the struggles of students living in deep poverty. Students who have to work from home in a community of poverty are contending with a different kind of obstacle altogether. For example, how do they create the dedicated study space they need in a one-room hut or a shack that is shared by a big family? For these students, just coming to university sometimes can be an escape from the social factors of poverty, whether that's overcrowding, which sometimes creates competition for basic things such as food and space to sleep, and can contribute to an environment that is not suitable for learning. Many of the students who I talk to about where they come from see university as their escape to a peaceful space in which they can focus on their studies, a space that they don't necessarily have at home. And we at UCT are committed to continuing teaching and learning through lockdown for those students who have the capacity, and to maintaining a high quality of the courses, even as our methods of engagement adapt to the new environment. Online learning is not new to UCT. It's been in practice for years. The Center for Innovation and Learning and Teaching was established in 2014 at UCT. And in 2017, we completed the Classroom Renewal Project, which revamped and improved over 100 classrooms across UCT campuses, including the installation of audiovisual and IT capability, lecture recording, and advanced customer support. By the end of 2019, about 60% of lecturers had chosen to record their lectures. Of course, that number is now increasing because of the immediate need for online learning. So as you can imagine, throughout the years, since 2018, we have a bank of lectures that have been recorded because many lecturers had already chosen to record their lectures. And we found that recording lectures and creating ways for students to interact with lecturers and tutors online allows students to more easily revisit course materials, ask questions, and get personal support in and out of normal teaching hours. Even when there is no lockdown, we record these lectures, students can access them on Vola, and they serve as a support for their learning. It gives them more flexibility to manage their time. The technology is especially helpful to students who may be second English language speakers or require accommodations for a disability. In 2018, we launched an automated video recording venue called the One Button Studio to support academics going online. The studio has been used by about 170 lecturers so far, and in March, we launched a series of webinars to help academics to transfer as much as possible of their course materials into fully online platforms. So the lockdown didn't find us unprepared. We were somewhat already into the game of online learning, and we already had the facility, the One Button Studio for lecturers to record their lectures. As a result of these efforts, academics who are reluctant to use these technologies are finding that they can indeed teach successfully in this way. And we are monitoring the lessons learned and seeing how these technologies benefit both lecturers and students, not just during the lockdown, but also when we can return to face-to-face learning. So our online teaching approach is not only for lockdown. It was there before lockdown. It will be there after lockdown because we also use it to support our students. We continue to keep the institution active during lockdown. Only a skeleton of staff remains on campus during lockdown, such as our security staff. Of course, also staff that are doing research on COVID-19. However, the functions of the university, including all the vital support departments, are fully operational as staff are working from home. In fact, colleagues, in my view, are working much harder than before. They're working in more complex circumstances as they deal with the demands of home, family, and work. Many are at their computers for longer hours. They work much longer, they schedule too many meetings. I can see many of them meeting after meeting online. Students are facing their own complexities. The practice of social distancing is demanding in and of itself. It takes special focused effort not to feel isolated. So we as a university have taken special steps to ensure everyone has access to support for their mental health and well-being, because that's important for us. UCT has a dedicated web page to inform staff and students about mental health hotlines, the support provided by medical aid providers, and tips for working from home. We are using remote ways of communicating to maintain a sense of community across the institution. UCT researchers and postgraduate students remain as active as possible, working remotely. However, in line with the national lockdown, we've put on hold almost all research in the laboratory, in the studio, or in the field. So students who were doing field work had to stop. Of course, UCT research expertise and social responsiveness remain strong in initiatives to support the government's response to COVID-19. Many of our colleagues are engaged with the National Department of Health, with the NICD, as well as the presidency to support the government in our response to COVID-19. And these efforts include developing vaccine candidates, epidemiology studies, drug trials, clinical research, reagents for testing, and developing low-cost personal protective equipment. I've got colleagues online later on. Professor Sudesh Sivarasu, Professor Val Misrahi will update you on some of the work, research work that we're doing here as the experts in the field. Other projects focus on the social aspects of the pandemic, including tracking and countering false information and using blockchain to protect individual privacy while tracking movements to help identify the spread of the virus. This work, as you can hear, is not just done in the Faculty of Health Sciences or in the Faculty of Sciences. Some of it is done in the business school, some of it in the Faculty of Commerce. Experts across the university are advising the government at provincial and national level. UCT academics are also engaging with the public online, speaking and writing on many different issues, including mental health, flattening the curve, online and blended learning, sports during isolation, reaching out to townships, among many others that colleagues are writing about. Many colleagues are serving on the front line of this health battle in local hospitals and clinics. I'm also proud of the members of members across the UCT community who are volunteering to help serve people with many different needs. For example, we have about more than 100 UCT medical students that are manning the COVID-19 hotline at the Tygerberg Hospital, at the Tygerberg Hospital Disaster Management Center. We have 2 young UCT alumni who developed Corona app as a centralized information repository to help people and prevent panic in South Africa. And we have a UCT student who organizes food deliveries to the elderly in the community during lockdown. Really, really work that makes us proud as UCT leadership. The message that the pandemic has brought home to my colleagues and I is that the university cannot and does not exist in and of itself. We do not exist separate from the community. We cannot uphold the old image of an ivory tower university that is remote from our community. Our long-held focus on social responsiveness has helped us make significant steps towards community building, but I believe that moving forward, we will have to think of ourselves as being in the community more than we've ever done before. Any crisis that the community experiences will come to us. It's just a matter of time. We are seeing in a new way how communities can shape what we do as academics, as lecturers, as students, and as researchers. And as UCT continues to diversify and transform, as we seek new ways to bring excellence into our work and into the world we serve, it becomes more and more important to recognize our relationship to the community. There are several questions that Russell has sent to me in terms of what people want us to answer to, and I'm sure the DVCs will respond to. Some of the questions have to do with when do we think the university will open again, and what will the university look like when we reopen. Truth of the matter is that we don't know when the university will open again. As to when we will open, it depends first of all on when the lockdown will be lifted. But you can imagine, even when the lockdown gets lifted, it doesn't mean that the effect of the virus will not be there. So as a university, we're going to have to think about how do we open the university and how do we make sure that everyone is safe coming back onto campus. So do we open all our residences? Do we open some of them? Who do we bring onto campus? When and how? And ensuring that people are safe. That will be key for us in terms of bringing people on campus. We will not rush to bring people on campus unless we know that it is safe. So we're going to ask the UCT community to bear with us. We cannot give you a plan in terms of when we are opening and how until we know whether exactly the lockdown ends the end of the month, or is it partial lifting, or is it full lifting on the lockdown. There are questions about finances and how we're managing our finances and whether we'll be refunding students. Let me say also that question is also premature. I mean, if you're a fee-paying parent, you will notice that normally around March, April, we already send reminders for parents, fee-paying parents to pay fees. We haven't done that this year because we recognize the uncertainty going forward. We've put a pause on that, but neither can we refund anyone their fees because what we are working on right now is the possibility of bringing students back onto campus, the extension of the academic year so that we can help vulnerable students cover up with the year. So it is possible that the year might go beyond, academic year 2020 might go beyond 2020 into 2021. And therefore, the students who paid RES, who will have to come back to RES, that payment will still be used because if we extend, you're still spending time on campus. We have, of course, considered the fact that students on financial aid have gone home, and so they need support. When they were at rest in catered residences, they were getting limited support because they are being catered for. And so we've introduced a miscellaneous allowance to allow them to be able to survive because they are not in residence, but they are at home and they are on financial aid. So we've made those kind of allowances so that students don't struggle and they have support as they get online. There are costs to the university, even if we're going to bring the students back, but it's important to make them. There's a lot of costs that come with COVID-19 that we never anticipated. The buying of computers and so on. And that's why we reached out to the alumni and we are grateful for the support that we have received so far. I myself pledged 20% of my salary into the COVID Emergency Fund. Many of you will know that I already donate 10% of my salary every month to a scholarship fund to support women postgraduate students. I'm now pledging 20% of my salary into the UCT COVID Emergency Fund to support the work that we need to do the expenses that come as a result of COVID-19. We can see the costs already in terms of buying laptops and sending them to students, and we'll be inviting the rest of the staff at UCT to pledge if they want to. My pledge is for 3 months for 20% of my salary to go into COVID emergency funding. So we are grateful to you, alumni, for the support that you give us. We look forward to working with you further. I know that you indicated your willingness to support, and later on we can talk about other ways of supporting the work that we do in COVID-19. I want to, Russell, to pass on to Sue if there's anything that she wants to add in terms of the research. Otherwise, I'll give over to you afterwards, Russell, for questions.
Okay, Vice Chancellor, then let's hear from Sue, but also just to let you know, because you may not have seen it, that Professor in Tobacco Enthusiast also joined us, who's head of our Department of Medicine, and he's also available to respond to some of the questions, the medical and research related questions.
Thanks, Tobacco. Is there anything you want to add?
Well, thank you for that opportunity. I think that it's good to point out the great variety of research that we're doing at UCT. And as we've said, we've got a number of our experts who could speak a little bit about the work around vaccines, a lot of work being done around testing and ways that we can use different forms of testing to be able to cover a bigger, to be able to follow the pandemic and also immunity in a more rigorous way moving forward. The research is very varied in that we have members of our community looking at the socioeconomic impacts and looking at novel ways of following the pandemic. So it really does spread across the university. There's quite a lot of clinical work to be done. We're an unusual population with the susceptibilities of HIV and TB, and we have particular researchers working in those spaces. I saw one of the questions which got asked at some point was, how are we using our own resources? And in the testing, it's one of the things that we're looking to do, in that we have a lot of specialist instruments, particularly things like PCR machines, which can be used, and a number of the labs in health sciences are looking to see how they can work in this kind of a way. So maybe that's just a quick update there, and we could go into specific questions as we move forward.
Okay, thank you very much, Sue. VC, the issue that's coming up a lot is related to, will we complete the academic year? Now, you have indicated that's what we're aiming for, and all likelihood what will happen. But related to that question is, how will we do assessments, and particularly people who do practical courses as well? You know, either the drama students, our medical students, where there are practical aspects to their academic program. How are we going to be addressing that to ensure we complete the academic year, and how will our students be assessed?
Thanks very much, Russell. The plan is to complete the academic year 2020. I'm going to ask Professor Liz Lange to switch on a video and respond to the question in detail about how we plan to deal with practical subjects, including School of Drama and Arts in the Faculty of Humanities. Liz?
Thank you, Vice-Chancellor. Good afternoon to everybody. Thank you for the question. What we have done is to extend the academic year. So we are going to be teaching until the following year in January. What we are doing is to the lockdown permitting, allowing the students who have practical requirements on campus sooner. So we are working with the notion that between August and September, we are going to start bringing students onto campus. That means that those students who require to do practical blocks, whether this is laboratory work, clinical work, etc., will be able to do that. We have planned in consultation with the relevant departments for 12 weeks for the performing arts to be able to complete the work. And in the case of the Faculty of Health Sciences, they are developing their own calendar to take into account the rotations in the clinical platform. There were questions about examinations. We are not going to have invigilated examinations at the end of the first semester because of the social distancing. And certainly we are not going to have any form of invigilated examinations for semester-based courses, but we will have invigilated examinations towards the end of the fourth quarter for all the annual courses that we have. I think that's, I mean, sorry, and in the performing arts, we are including, of course, the students in the School of Music. Mm-hmm. I think that completes that question, Vice-Chancellor.
It does, Liz. Thank you very much. Of course, somebody asked why are we not communicating with students? The truth of the matter is that we've been communicating with students. There's been DVC desks, and there's going to be another DVC desk that's coming out this week, right, Liz?
Tomorrow, Vice-Chancellor.
Good. So we are communicating with students, and they should look forward to another DVC desk coming out tomorrow that gives more detail. But otherwise, all the students are aware that we're starting on the 20th. There's orientation, and then from then on we'll start. Of course, the delivery of the laptops has started with us, that it be declared an essential service so that all the students who need laptops can get them delivered to their homes wherever they are in the country. Russell?
Thank you, Vice-Chancellor. Just to all those who are on the call, just bear with us, because there is a little bit of delay when the person who is speaking, when it changes to live. So people are queued and then they made live, but there's sometimes a 30-second delay, and that's why you don't see the person coming up immediately, but you will eventually see who is actually talking. So just bear with us. Vice-Chancellor, because I see that DVC Liz Lange is still live, although she has moved, she's no longer talking. So that's the reason for that. There's a bit of a delay, but it does catch up with us. So VC, related to that question is how will this impact on the academic year 2021 then, if we are extending? Are there any concerns about the academic year 2021 if we are extending so far into next year?
Russell, there will definitely be implications. We're working on scenarios, and as you can imagine, because at the moment we don't know whether when the lockdown exactly will end and how it will end. So we're working on scenarios for the academic program. We're working on scenarios for finances and fees. We're working on scenarios for residences, so that when it gets clearer as to where government is going in terms of the lockdown, we know which scenario would work. But the registrar is online, and I know that he's been preoccupied with the idea of student recruitment, enrollment. Our system is out there. We are already recruiting students online, and we are gearing ourselves up to welcome a new cohort of students in 2021. So we are being positive in terms of the fact that we will complete 2020 and admit new students in 2021. Royston, do you want to say something there?
Yes, I will. In terms of the timeline that has been described, and of course we know that that is not absolute. It could change, and it could change because of reasons beyond our control. It has already been said that no one controls the timeline. The timeline is controlled by the virus. But if the timeline that we have worked out proves to be valid over the next few months, as much as this year will end later than we would ever have planned, and as much as there will be an impact on the start of 2021, by our planning, we will probably be in a position to commence lectures about 2 weeks later than would ordinarily have been the case in 2021. So as things stand at the moment, the planning for 2021 is on track. We will make the accommodations as necessary to recover 2020. And we think our best case scenario is to be in a position to commence the 2021 year 2, maybe 3 weeks later than would ordinarily have applied in a regular cycle.
VC, related to that, so I suppose we should keep the registrar on, is the question around graduations and how will that take place under these conditions?
So the position on graduations is UCT at the time, earlier in March, because March is our key graduation cycle month at this university. We took a position at the time because it was enforced on us to suspend the graduations that were scheduled for March. We are not in a position at this particular point in time to make any definitive comments about how grad will be dealt with into the future, other than to recognize graduation is important. It's important in the calendar of the university. It's important as events at the university, and we recognize it's important for our students and our staff and families, particularly the families. So it is something that is on the radar for consideration, but in terms of how exactly we will arrange it into the future will depend on the circumstances that prevail over the next many months.
And related to that, VC and the registrar, is how there's also a question of how we deal with admissions, particularly given the role that the national benchmark testing plays in admissions in certain faculties.
So the national benchmark tests are an important part of our admission system. We use it for two purposes. In some faculties to make admissions decisions, in other faculties to inform placement, and generally to be helpful from the point of view of diagnostic information that it gives our academics in terms of what they need to accommodate in terms of teaching practice based on the diagnostics that become clear through what the NBTs generate. It is a fact that the COVID-19 scenario has impacted on the planning and the testing arrangements for the NBTs. We are exploring options in terms of whether those NBTs can still be offered. It might be the case that the timeline shifts. I think it's inevitable that the timeline will shift. It may well be the case that NBTs are going to be required to be written later on in the year. It is also the case, though, that we are giving due consideration to the basis on which we make admissions decisions for students who come out of schools on the basis of results indicators that we already have. So typically that would be grade 11 results, which everybody in grade 10 and grade 12 at the moment would already have. We are not at this particular point in time saying that that will be the only basis on which we will make admissions decisions, but in fact it is a reality that that is a set of indicators that we already have. It won't be new for UCT to look at final grade 11 results. 2 years ago we already started to do that to inform admissions decisions. We think that will become more of a factor, not only for UCT, but for all public higher education institutions in the country. And we will continue to monitor the situation. We will continue to monitor what happens with the school calendar and timetable. We anticipate that the matric exam timetable is also going to be seriously affected. So we are alive to that and we're watching those indicators all the time.
Thank you, Registrar. And VC, there's a question also related more to the postgraduate study. Is are we still allowing people to register for PhDs when they need to obviously establish who their supervisors are going to be? How has that process been handled under these circumstances?
Okay, I'm going to ask Professor Sue Harrison to respond, but let me just throw a comment here and say, you know, if I were a PhD student at this point, there are areas of study that probably at this point students should be grabbing the opportunity. If you're doing economics, if you're doing politics, if you're doing, you know, there's research areas that you can get in now, and this is the good time to start your PhD. So I would hope that in some areas of study, students actually see the current situation as an opportunity to grab and run with it for their studies. Sue.
Thanks, Katie. Yes, we are accepting postgrad students at this stage, just as we always do. And I'd like to support what the VC says. Particularly the early part of any PhD or postgrad study requires a lot of desk work to begin with, where you need to look into what's already known and frame your questions and frame exactly which work you want to do. That's perfect to do right now. And with our postgrad students who are studying at the moment, for those who have a workspace and the tools that they need, this is also a great opportunity to be able to do that kind of work, but also to sit back and look at what data you've already collected and things you already know, and do that really serious thinking about what it implies and how to move forward. So I think we can use parts of the lockdown period really well in postgrad study. Of course, there are those students who also really need to get back to the lab, and we'll be looking to see how well we can do that and how quickly we can do that.
Thank you, VC. So that's actually a nice segue into a question that comes up often, is that part of the reason why we're struggling, obviously, with this pandemic is because we don't have a vaccine. And so people are interested to hear how close are we, what is the global research showing, and how is the country, and particularly the University of Cape Town, involved in that attempt to actually find the cure, to develop the vaccine. Where is the world and the country at this point?
I think Professor Mizrahi will be best positioned to help us with that question. Val?
Yes, thank you very much, Vice-Chancellor, and for this opportunity to speak to the alumni. As of 5 days ago, there was a report published, a top international journal, stating that there are 115, I emphasize that number, 115 vaccine studies that are currently underway around the world. These involve China, North America, the UK, Europe, many countries, and are public-private partnerships involving research institutions, universities, as well as big pharma, as well as the biotech industry. Now, here in South Africa, there is one group here at UCT I particularly want to mention that are drawing on years of expertise and experience working in HIV vaccine research and are bringing their tools to bear on this particular problem. They're using different systems to express proteins or components of the virus that causes COVID-19 in different types of systems. The one system is to express them in plants. The second system is to express them as so-called DNA vaccines. And the third is to place them inside another virus, a crippled virus, to use a viral vector. 3 are being investigated. I think realistically, the early gains that this type of research will achieve is to produce reagents that we can use for other types of diagnostic testing, in particular pieces of the virus that can be used, for example, in serological testing, which again represents another major area of research strength and interaction of UCT researchers with researchers across the country. In terms of the vaccine field, I think it's important to emphasize what has been said internationally. Safety first. We are accelerating globally vaccine research for COVID that has built on the back of vaccine efforts in other areas of coronavirus as well as flavivirus research. Still, there are no shortcuts with respect to safety. And so I think that the figures that are put out there of 12 to 18 months as the shortest period of time is what we have to accept. But so, I want alumni to understand UCT researchers are part of this major global initiative.
Thank you. Maybe related to that, VC, is a question, and maybe Val could also sort of stay on, is whether we are repurposing some of our facilities at the university to assist in addressing this COVID-19 challenge.
So thank you, Russell, for that question. And the answer is a resounding yes to that. We are looking, for example, at laboratory infrastructure, and I think Sue mentioned this earlier. We are working as part of a national initiative drawn from multi-institutions across the country, research and academic, to look at what kind of high-end equipment can be brought to bear on the top challenge we face at the moment, which is ramping up diagnostic capacity and doing this in a way that is supportive of the National Health Laboratory Service, the NHLS. And the Medical Research Council is convening this discussion. We at UCT have put forward a proposal to work hand in glove with our colleagues in the NHLS laboratory at Chryskio Hospital as well as in Greenpoint to see what we can do to assist. And I think that this is one illustration of the way in which researchers are finding themselves in a position of being able to offer expertise to address, for example, some of the bottlenecks in the diagnostic pipeline without taking away the responsibility of the NHLS, which is by government law, is the provider of pathology services to the public sector. We are doing our best to work together with them. I think it's really helpful here to bring in Ntobeko and Tusi, who can comment on the way in which people in the health sciences faculty are contributing in a very profound way in terms of clinical service delivery outside of the diagnostic space.
Thank you. Then Ntobeko, you would like to add? He's head of our medicine.
Thanks to the VC for the opportunity to contribute to this conversation.
You have to turn your video on, otherwise they can't put you live. So you have to be on video to be live. Wonderful. I think my video is now on. So outside of the research domain, there have been a number of important clinical contributions from the establishment of new clinical services, which include a screening and testing center for people who are suspected to have the infection, to new inpatient services, which include wards where we look after patients who are either persons under investigation or people who have in fact been confirmed, who are either not able to isolate at home or who are too sick to be at home, as well as critical care settings where we can look after those who are very sick. And in fact, we have a number of patients in all of those domains. But outside of the frontline clinical work, there are also a number of important areas of clinical investigation, which range from studies looking at the safety of healthcare workers to studies trying to understand the biology of this virus, to a number of randomized clinical trials to test out the ideal forms of therapy for managing patients with this virus, as well as a number of surveillance studies trying to understand the impact on populations. And very proud that our clinicians are involved in all of these important lines of inquiry. Thank you. Thank you, Professor Ntuzi. VC, just to turn back more internally to the university, an issue that has also come up is our international students, particularly in high-risk countries. How are we supporting them, and what are the chances of them coming back to the university when it's or are we going to have to just have a wait and see approach, given that this timeline is really not under our control?
I mean, the thing about this crisis is it affects the whole world, and I will hand over to Sue now soon. It affects the whole world. So those students who come from other countries, actually, there are countries like the US started recalling their students as soon as the pandemic broke. Just as we were evacuating students, the US was saying students should come back home. So it's a concern on both sides. It's our concern, but our view is that their families are concerned too. We also have other international students who are still in South Africa who when we closed our residences, their borders were closed and they couldn't go home. And Sue can talk about the numbers and so on. They are located in our leased residences around here, and we are supporting them as much as we can. There are also other international students who are in their private accommodation. They rented those accommodations, so they paying and they're staying there. It is not our arrangement. They made arrangement to stay there because they are studying at UCT and they chose not to go home. We support them just like we support any other South African who's at home, because it's a similar situation. It's not so different from a student who is in Khayelitsha now or in Constantia. They are just in private homes. So we're trying to make sure that what we offer our students, we offer as reasonable as possible to our international students. Sue?
Thank you, VC. And I think you've covered a lot of it. The international students are really a diverse grouping of people. And for those who've stayed in Cape Town, we, as we say, we support them as well as possible. We had a number of students, international students, who couldn't return home, and those students have stayed in our reses. It's not a huge number, but they are being they are being looked after, they're safe in our residences, and we make sure that we check on their well-being. We have students all around the world now, and for some, going online has been made their space better. For instance, our semester study abroad students were taken home back to the States and other parts of the world very early, and now that our courses go online, they can complete their curricula. For other students who are in parts of Africa where connectivity isn't good, it will be much more of a challenge. And whereas in South Africa we can deliver laptops and so on, in other parts of the world we can't do that. So we'll support all our international students as well as we can. It's a very diverse group, and we will make arrangements for each group as we are able within the resources that we have.
Thank you. VC, you explained that, of course, we don't know when we will be able to open the university and return to normalcy, whatever the new normal is going to be. But what has come up is what plans are there in place in terms of things like social distancing, ensuring that we sanitize, wearing of masks. Are we thinking about some of those issues for when people can come back, even if it is a phased return to the university?
Yeah, my suspicion is there is going to be a phased return to the university, and as I'm talking, I'm going to ask Sudesh Sivarasu, our biomedical engineer, to in a moment talk about the work that he's doing with PPEs. But I think it's going to be a phased return. I think irrespective of whether the lockdown is lifted or not, I don't think it's going to be easy just to return masses of students and everyone on campus immediately. First of all, there's going to be a human factor that some people will themselves not feel safe enough to come on campus, and I think that's reasonable, given how the pandemic has unfolded. And we are going to have to rethink, and I've asked Professor Ferris with her team in Student Affairs to work on scenarios for residences for when we come back, so that we can have a scenario. If we have to come back, bring students back in June, what will it look like? How many per res, which residences, and how will we staff those residences and so on? We've got to think carefully about that. But whatever happens, if when the lockdown gets lifted, those of us going back onto campus, we will need to take extra precautions. Masks are going to be necessary, sanitizers, gloves. And I want to ask Sudesh to talk to us about what he's doing with his team in terms of this work, because my hope is that we don't have to procure these things outside the university, that they are produced on campus and can be used on campus. Sudesh? Thanks.
Sudesh with biomedical engineering. If you can turn your video on, because then they can cue you in live. If it's off, they cannot see you.
My video is on.
Okay. So you can speak, and they will make sure that you are the next person on live.
Thank you, Russell. Thank you, Vice Chancellor and the Alumni Department and the alumni folks. With respect to medical devices related to COVID-19, we have formulated a task team, and we're working on a variety of medical devices. For instance, from low-cost phase visors to reusable N95 masks, and all the way to ventilators. So, in fact, our team has made an application to the National Ventilator Project, and we have been screened 2 levels by the National Ventilator Project, and we're going to be doing our final presentation tomorrow, and with the hope that UCT and with its collaborative team would be able to contribute to the larger ventilator need in the country. And we are pretty positive about meeting the requirements of technology in this COVID crisis, and specifically, around mass testing of coronavirus, we have been able to produce low-cost flock swabs in-house, and we are now in the process of making it available in a larger scale and going through the registration process and SAPRA approval processes. And that is the next step. And coming back to the Vice Chancellor's point about making locally available or in-house made personal protection equipments, we have successfully created disposable visors, and which can be made with almost limited resources at less than 10 rands a unit, and we will be rolling out these products starting next week. The product has been registered for SAPRA now and waiting for the final approval from SAPRA, and hopefully with that we should be able to roll out massive numbers of these personal protection equipments. Again, I would like to emphasize that in the efforts of flattening the curve, we should support the clinicians who are helping to flatten the curve by not reducing their numbers, which will have an inverse effect on the curve. So our primary focus has been about trying to support the clinicians as much as possible in delivering their services and to flatten the curve. And there's been tremendous support for this initiative, especially from across various schools within the University of Cape Town and also across different institutions where we haven't really worked in the past together, but now there's been a lot of interest and engagement with different stakeholders, and all of them trying to contribute to this larger problem around technology access in COVID-19. And we are pretty positive about making a real impact in this situation, and where we would like the alumni and the extended alumni support for these initiatives.
Thanks.
Thank you,
maybe if you can just say what SAPRA is, just for the benefit of those who don't always understand the acronyms, including myself.
Sorry, so SAPRA is the South African Health Products Regulatory Authority, which approves all the health related technologies that can be used on patients or clinicians.
Thank you very much. So, Vice Chancellor, I think we kind of coming to the end, and just two things, and I'd like you to maybe in conclusion. One is maybe you can share what the Faculty of Health Science is doing in terms of webinars, so that those who are interested in getting more in-depth knowledge in terms of the scientific health and research side, they would be able to benefit from the webinars. But then what has come up from many of alumni is they would like to know how can they assist the university during this difficult time, and maybe you could suggest some ways in which we would really value their support for their alma mater.
Okay, so thanks, Russell. So the Faculty of Health Sciences holds a webinar every Wednesday, and I'm sure Val and Ntobeko can talk more about it. But it's I think if you search for UCT COVID-19 Echo Clinic via Zoom, you would get that. It's on Wednesdays. It starts at 4 until 5, but it's every Wednesday. And so you get update information on the work that they are doing in the faculty related to COVID-19. Otherwise, you can also send an email to the alumni office so that they can send you more information on the webinars in the Faculty of Health Sciences. And I think in terms of how you can help, I mean, I would say there's lots of things that are going to be different after this. As you can see, I mean, COVID is affecting the economy hugely. Student financial aid is our biggest line item on our budget every year. And I want to encourage you to give to the UCT COVID-19 Emergency Fund, because we are going to need to tap into that fund. Once we are done with buying laptops and providing for students who need them, there is financial aid that we're going to need. People are really, there's going to be jobs lost as the country recovers from this. Economists think that it might take us 18 to 24 months before we re-emerge as a country. And that will have impact on many of our students. And we would like to make sure that students who have an opportunity to come here can actually study here without any hindrance. And so your donations will be very, very useful. But I think more than that, I mean, the moral support that we get from you. I mean, I think the world is changing. I mean, I want to end on these general remarks that the world is changing. And I feel like I've been saying this since 2012. In many of my speeches, I talk about this changing world. And when people want to tease me, they say I'm pontificating about the world. But the world is changing. We have never seen anything like this before. And in many ways, it is the end of business as usual. Anyone who wants business as usual will struggle to find it at the end of this. In a way, we're going to have to rethink the university. As much as many systems around us are going to be having to rethink themselves. And so I keep asking myself, what kind of university is going to emerge out of this crisis? My view is that we as UCT are much better positioned, not just to survive this crisis, but to thrive through this crisis. And it's because of our strength, because of our history of excellence and the excellent people that we have in the university. But we've got to give up the idea that things are going to go back to normal. We've been talking about this Generation C being out there, and we are now in a way beginning to behave like it, work like it, and the characteristics, attitudes and values of Generation C are going to be some things that we need. We've been talking about skills of the future and the graduate of the future that we want to produce. And I think more now than ever before, it's necessary for us not just to talk about a graduate of the future, but the kind of graduate that we need to be producing now, who's able to deal with uncertainty, the kind of graduate who's not faced by rapid change, that they can problem solve and ride the wave as it comes. So I think there's a huge opportunity in this crisis. I don't only see danger, I see opportunity, and I think as UCT we can grab it. And I think someone wrote here in one of the questions, what's the best thing about being at UCT at the moment in this crisis? And I think one of the best things is that when we're in a university that's strong, that's got a history of excellence, a history of supporting vulnerable students, then you know you're in good hands. Our vulnerable students, hard as it may be, it is much better to be at UCT at this point than anywhere else. Thanks very much, Russell, and thank you very much for everyone who attended, and hopefully we'll connect again in future.
Thank you, Vice Chancellor, for those concluding and encouraging and uplifting remarks. And I just want to thank everybody who joined this live discussion. In the alumni department, we would really appreciate some feedback from you, whether you found this useful, whether you think we should have further live discussions, and what type of issues that you would like us to address. So thank you very much, Vice Chancellor, and thank you to all the senior leaders within the university making time available, and good luck to Ntobeko, Val and Sudesh, the wonderful research work that you're doing, and keep safe out there, and we will connect with you soon again. Thank you very much.